What if I told you that in India, getting sick is not just a health problem, it can turn into a financial crisis, a system failure, and sometimes even a matter of luck? India has some of the best doctors in the world. We perform complex surgeries, we have advanced hospitals, and medical science here is constantly improving. But at the same time, millions of people still struggle to get even basic healthcare. So what's really going on? Let's understand this in a simple way. India doesn't really have one healthcare system. It has two. On one side, there are private hospitals, clean, fast, and advanced. On the other side, there are government hospitals, crowded, overworked, and often short on resources. Now, both of these systems are important, but the experience depends on how much a person can afford. Healthcare in India is deeply connected to income and location. Most people still pay directly from their own pocket. Insurance coverage is limited, and even one hospital admission can wipe out years of savings. Because of this, some families delay treatment, and over time, healthcare itself becomes a financial burden. At the same time, healthcare is also a large and growing industry. Hospitals use advanced technology, run complex systems, and deliver high-level care. But for many patients, this also creates a difficult question. Do I really need this test? Doctors today often work under intense pressure, long hours, high patient loads, and constant expectations. The system itself has become more complex than ever, and somewhere along the way, something has started to change. Trust. Earlier, doctors were often seen as part of the family. Today, many patients feel uncertainty, and one of the biggest reasons behind this is communication. When patients don't fully understand their condition or the reason behind treatments, confusion turns into doubt, and doubt turns into fear. Because in healthcare, trust is everything. Government hospitals in India handle an enormous number of patients every single day. Despite limited resources and infrastructure gaps, they continue to provide life-saving care to millions. The issue is not capability, it's capacity. There are simply too many patients and not enough resources. And then there is another challenge, geography. In many rural areas, reaching a hospital itself is difficult. And even if someone manages to reach, there may be no specialists available. So the problem is not just availability, it's accessibility. At the same time, our system focuses heavily on treatment, but not enough on prevention. But the truth is simple. Prevention works. It is not only effective, it is also better and cheaper in the long run. Yet many people don't follow preventive care, not because they don't care, but because they don't fully understand. This gap in knowledge creates confusion, and over time it leads to fear and mistrust. That is why communication and education are so important. When doctors and patients understand each other clearly, trust begins to rebuild. So, can it improve? Yes, India does not lack doctors. It does not lack knowledge. What it needs is awareness, better choices, better communication. Because healthcare should not feel like fear. It should feel like dignity, security, and peace. And it starts with the choices we make. For best healthcare outcomes, choose qualified doctor over quacks.